going to talk about one of my favorite joints in the body, the shoulder complex. There's a lot going on in the shoulder, so sometimes rehab and treatment of it can be a little bit tricky. For starters, most people come in with shoulder pain that's been going on for a little while. So other than acute trauma to the shoulder, most of these shoulder injuries occur from overuse or bad postures or a combination of both. So what I'm going to discuss today is what's commonly known as subacromial impingement, or what patients commonly describe as that pinch that you get in your shoulder when you raise your arm overhead, just like this. So what usually causes it is that you have your rotator cuff muscles, and the tendons of these muscles run right in between the two bones that make up your shoulder joint. So that when you have bad postures or overuse of that joint, it can cause pinching of those tendons, which can result in pain and inflammation. Most of us are upper trap dominant and lose the ability to properly contract our lower traps and our serratus anterior muscles. So when we raise our arm out to the side like this, our arm bone is moving, but our shoulder blade actually lags behind, and this can cause lots of problems such as impingement. So now I'm going to show you some exercises of how to address this problem. The first exercise we're going to do is called a Pushup Class. So this exercise focuses on strengthening the serratus anterior. So this muscle helps with upward rotation of the shoulder blade while keeping your shoulder blade flat against the rib cage. So first thing you're going to do is get up into a push-up position, just like this. So you want to make sure your back is nice and flat and that your knees are straight. So instead of bending your elbows like you do in a normal push-up, you want to keep them straight, but instead you're using your shoulder blades and going up and down with those. So just like this, you squeeze your shoulder blades together like that, and then you push up so they're flat against your rib cage. And squeeze them together, and flat up. Good. So you want to do this about 10 times. The next exercise we're going to do is called a lower trap lie raise. So as the name implies, this exercise focuses on your lower trap muscles. So what you're going to do is lie flat on your stomach and have your arms in front of you shaped like a Y. And what you're going to do is you're going to lift your chest up off the ground, hold it for about 3 to 5 seconds, and then come down slowly. Good. And one more time. And come down. Again, you want to do about 10 repetitions of this. The next exercise we're going to do is called Serena Punches. So again, this exercise focuses on the serratus anterior muscle, but it is a little bit less intense than the Push-Up Class exercise. So what you're going to do is raise your arm to about 90 degrees flexion, have it straight up facing the ceiling, and I want you to keep your elbows straight the entire time, and you're going to try to punch the ceiling. Good. So when you punch, you want to feel as if your shoulder blade is flat against your rib cage. Hold it for about a couple seconds, and then come down. Here I'm using a 5-pound weight. If it's too painful to use any weight, then start off with none, and you can keep increasing it as it feels better. The last exercise I'm going to show you are rows. So what you're going to do is you can find a stretchy TheraBand just like this one over here. You want to have your arms right at your side like this and elbows bent to about 90 degrees. Start with a little bit of tension on the band, and you're going to pull your elbows backwards while squeezing your shoulder blades together, as if there's something stuck in between your shoulder blades. And relax. Good. And again, so you want to hold it for about 3 to 5 seconds, and relax. Good. And you're going to repeat that about 10 times as well. So some of the exercises I just showed may be a little bit too painful to start off with if some of the range of motion is still limited and you can't bring your arm up right away. But they are exercises to work towards, and hopefully as the pain decreases and we're starting to work more on the strengthening exercises, these are good exercises to do. So that's the end of our video today. Thanks for watching, and if you do have any shoulder problems, feel free to give us a call. I'm Courtney, and I am the physiotherapist at Full Function Rehab and Wellness.